PLO Gels. Pluronic lecithin organogels are two-phase systems which combine to form an emulsion with the ability to deliver drugs systemically through topical application. They are characterized by an oil and an aqueous phase, which must be used in a strict ratio to obtain a stable emulsion. The lecithin constitutes the oil phase. In a PLO gel, it will always represent approximately 20% of the overall volume. The pluronic gel is the aqueous phase, and it represents roughly 80% of the overall volume. Any active pharmaceutical ingredients and solubilizers will be subtracted from the aqueous phase, not the oil phase. Luer lock syringes will be used to combine the ingredients of the gel. Start by removing the plunger from both of the 30 ml syringes and cap the tip of each. It helps to use an empty beaker or pill vial to hold the open syringe barrels upright during the initial preparation. Measure the appropriate amount of lecithin oil in one of the capped syringes. Replace the plunger and push the plunger until an audible snap is heard. This sound is due to the rubber end of the plunger clearing the back end of the barrel. Turn over the syringe so the tip is pointing upwards, remove the cap, and place a finger over the open tip. Slowly push the remaining air out of the syringe. Adjust the measurement. And then attach the luer-to-luer connector. Next, weigh the active pharmaceutical ingredient and pour it into the second syringe. Select an appropriate solvent for the active pharmaceutical ingredient. This can be glycerin, alcohol, ethoxydiglycol, or propylene glycol. In this video, propylene glycol will be used. This solvent can represent up to 10% of the overall volume, but remember to subtract this volume from the aqueous phase volume. It is important to note that if the active pharmaceutical ingredient surpasses 25 to 30% of the total volume, the emulsion will either crack or not form at all. Measure the correct volume of solvent using a 5 ml syringe, then add this solvent to the syringe containing the active pharmaceutical ingredient. Gently replace the plunger in the end of the syringe, but allow the air to remain inside the barrel. Shake the contents thoroughly until the drug is solubilized. Then remove the plunger. Now pour the pluronic gel into the syringe that contains the solubilized drug and QS to the desired volume. Replace the plunger, shake, and repeat the process of removing the air. Attach this syringe to the luer-to-luer connector on the first syringe containing the lecithin oil. It is important to remember to always inject the oil phase into the aqueous phase first. With the aqueous phase on top, hold the system with both hands at the connector point and push downwards against the work surface. This will depress the plunger from the oil syringe and inject its contents into the aqueous phase syringe. Rotate the system 180 degrees and plunge again. Repeat a minimum of 10 times. Please note that the luer-to-luer connector can be temperamental and can often come loose. To minimize the risk of making a mess and losing the product, Grasp the syringe system at the connector point to stabilize this weak connection. Remove the empty syringe. PLO gels are generally subdivided into smaller syringes, each containing 1 dose. A few notes on PLO gels. The process of pushing the gel back and forth between syringes is critical in forming the emulsion and also facilitating the formation of micelles, which aid in the transdermal delivery. The Pluronic gel possesses thermoreversible properties. This means that when refrigerated, the substance is a liquid, and at room temperature, it's a solid. Therefore, it's important to counsel patients that they must not allow their PLO gel to get cold, nor should it ever be refrigerated. If this were to happen, the Pluronic gel would liquefy and the emulsion would crack, rendering this compounded preparation useless. Finally, remember that a PLO is not a cream despite its appearance. The nature of the PLO is to deliver drugs through the skin and into the bloodstream. Therefore, the patient needs to heed the prescriber's instructions and only apply the specific measured amount of drug as directed. As mentioned, PLOs are often dispensed in unit dose syringes rather than in a tube or ointment jar to allow the patient to more easily and accurately apply the prescription. This concludes the video on PLO gels.